Good afternoon, everyone. Sorry. I'm Allison Wyckoff, Manager of Public Programs here at the Asian Art Museum, and I'd like to welcome you to today's talk, Exploring the Elixirs of Immortality, Ancient Medicines and Modern Beauty with Amy Petrarca. While researching terracotta warrior programs, I became curious about the theme of immortality, which is woven throughout the exhibition, and the practices of yin-yang medicine, feng shui, and divination that were employed by the first emperor and his team of alchemists in their quest for everlasting life. I began to see parallels between the modern quest for beauty and the current obsession with youthful skin and bodies, and realized there isn't much difference between the first emperor's pursuit of immortality and our own through creams, injections, and surgical procedures. We are lucky to have Amy Petrarca here to help us explore this idea further and to introduce us to the many forms of traditional Chinese medicine through an in-depth focus on facial constitutional acupuncture. Amy Petrarca is a registered nurse and licensed acupuncturist with broad experience in emergency rooms and hospitals around the country, most recently at SF General, where she was the charge nurse for many years during the weekend night shifts. Reinventing herself as an integrative medicine practitioner, Amy has spent the last 11 years immersed in the study of traditional Chinese medicine, founding BioHealth in 2007. She is one of 25 international acupuncturists chosen to participate in the first ever gold standard facial acupuncture certification program at the Northwestern Health Services University in Minneapolis, Minnesota, and is scheduled to complete her 200-hour certification in October of this year. Thank you all for coming. Without further introduction, please help me welcome Amy.
Hello, good afternoon, everybody. My name's Amy Petrarca. Thank you for that beautiful introduction, Allison. It's an honor to be here, so thank you all for coming. I was so excited about being here today that I actually commissioned a piece of artwork for you, which you'll see up here as my first slide. It's called Faces. And I think it's beautiful and intriguing, and I love the way that it turned out. This was completed by a local artist named Jamaica Dyer. So thank you very much, Jamaica, for this beautiful piece of work. A wonderful way to start contemplating beauty. So welcome to the Elixirs of Immortality, Ancient Medicines and Modern Beauty. I won't belabor the history of myself, and you are more than welcome to read about me further on my bio. It's on my website, which is on the business cards that were on each of your seats, and I'll be leaving you with that information at the end of the talk today. I have the incredible privilege of introducing my new colleague who I met at the Gold Standard Facial Acupuncture Certification coursework in Minneapolis last year in April of 2012. She flew in from Tampa yesterday to help me specifically with this lecture and demonstration. Please help me introduce Dr. Corinne Wolf. As you can see, Dr. Wolf has also some extensive credentials, and I'm thrilled with what she's going to be able to provide and share and contribute with not only the lecture, but the demonstration. Thank you for being here.
You're welcome. Thank you for having me, and thank you for giving me an excuse to return. I had lived in Sausalito many years ago and hadn't been in the Bay Area in a long time, so thank you for welcoming me back.
So Dr. Wolf will be intermediately interjecting whenever she wishes. I've asked her to do as such. I really appreciate her energy and her expertise, and I think you will too. Before I get too distracted into the material, I wanted to make a comment on the gifts you have on your chairs. I chose the gold organza bags because I think they're darling. But also, I wanted to give you all a gift. So inside the bag's not only my business card, but the DNA Skincare Zen Therapy Treatment Gel. And this is a beautiful organic topical product. I use this in biohealth facial acupuncture. However, I do want to make sure that because of the small packaging, that you visit the table at the back where the tea is and look over the ingredient list, just to make sure that you personally don't have any issues with any of the ingredients before you use it topically. This product enhances tightness, firmness, and texture of the skin. It helps to regulate oil and sebum production. It's great for use with rosacea skin conditions. It cools and soothes irritated skin and has a calmative and anti-stress effect. So, and I actually really like the name that it's called, Zen Therapy Treatment Gel. So, I wanted to dedicate today's lecture and demonstration to the city of Boston, Massachusetts. So if you all wish to join me in just holding some light in your hearts, there is something really important in Chinese medicine called yin, and it means intention. And so it's my intention not only to be with you present today, but to keep the city of Boston in my heart. So I invite you to join me on that. Can you believe this is the Terracotta Warriors and we have some of them here in San Francisco? I mean, this is such a great opportunity. Have any of you already seen the exhibit? Any comments about this exhibit? It's an enormous magnitude to even think about. And you know, I have to tell you, one of the things I like about being a part of the Terracotta Warriors exhibition is because this is something that was discovered in my lifetime, and it really helps me feel tied into history. So you've heard of Qin Shi Huangdi. Qin Shi Huang, I think Allison spoke a little bit about this with ancient behaviors with the quest for immortality. And in the beaker on the right-hand side here, I have pictured liquid mercury, which legendly Qin Shi Huang was said to have consumed in great quantities in his quest to stay young and beautiful and powerful. I don't recommend drinking liquid mercury. I absolutely think that we have other alternatives and options, and I'm here to share some of those with you today. So when I was preparing for this lecture and demonstration, I found this really fun blog, and it was talking all about these ancient beauty secrets. And Dr. Corinne has some of this to share from the blog.
Every morning, Empress Dowager Shi applied face powder makeup made of pearls and skin cream made of flower distillate. At night, she applied egg white, kept it on until a half an hour before sleep, and then applied flower extract, finally patting her face dry with soft towels. Furthermore, she used a jade face roller, cool and smooth, on her face again and again every morning before dressing. High-quality jade is believed by many to have natural health-enhancing functions, and repeated rolling is, in essence, a good massage for the face. These beauty techniques are used today at modern spas around the world. But let us look back at more examples of classical Chinese beauty treatments.
Thank you for sharing that, Corinne. I was excited that we found that because so many of those techniques are still used. Unlike the mercury, we still use pearl powder, and we still use jade rollers, and we still use egg whites or embryonic proteins topically on the face to enhance the complexion and to enhance beauty. So I punched in the word beauty on the Google, and these were some of the images that came up. As you can imagine, there were lots of images. I wasn't too surprised, but I was at least aware of the fact that they were all female faces. Pretty interesting. Is this what you think of when you think of beauty? Is this what our culture thinks of when we think of beauty? Then I decided to Google natural beauty. These were some of the images that came up on my Google bot. But what about these faces? Do we consider these faces to be beautiful? Why or why not? So, with that in mind, let's see if we can't redefine beauty. I'm interested in this group. What do you think of when you think of beauty? How can we define it here and now? Can be any comments, any words? I love an interactive audience. Don't be shy. Somebody has to break the ice. Yes? Pleasing to your senses. I like that, especially that you mentioned the senses, that it's not just the sight. And we incorporate all of the senses in Chinese medicine, so thank you for mentioning that. Yes?
I think the eyes are leading into the soul of the person.
Absolutely.
And that to me shows much more than what you see on the outside.
So let me paraphrase this for the benefit of the group. What you see in the eyes, a window to the soul, much more important than what we're seeing on the exterior. Is that right? I actually don't think I could have said that better myself, and you'll see that your crystal ball is working because this is a few slides from now. So thank you for bringing that. We will actually introducing a Chinese word called shen, which explains this, the spirit of the person's beauty that is illuminated through the eyes, a direct window to the heart. Yes. Yes.
Mm-hmm. And I'm not for everything that they are.
I love this. I love this answer. So, thank you for contributing that. For the benefit of the audience, I'll repeat it to the best of my ability. It sounds like there's a timeless quality to beauty, that of the essence of who a person really is, their personality, their integrity, their and how that projects throughout their lifetime, that in your heart or in your mind, in your experience of a loved one's beauty, it seems to be transcendent of time. Yes?
Well, speaking about external surface beauty, one of the factors is proportions and balance of proportions. And classically, there's golden mean in certain proportions that are considered aesthetic. But I would generalize by saying harmonious, like harmonious.
So once again, for the benefit of the group, I'll repeat that to the best of my ability. Harmonious proportions, the golden ratio, what we're looking for in perhaps a face with proper proportions. And I think that's actually a good place to bring you with the next slide. One of the ways that our media and culture defines beauty is through symmetry. And that has a lot to do with proportions. We have often defined beauty as a symmetrical face. Many of our actors and actresses in the movies, and even the person we want to bring us the news at 6 p.m., we want that face to be symmetrical. But I'm here to tell you that faces are not exactly symmetrical, even those that we may define as beautiful. I actually spent a little too much time with these images that were a right and left mirror. As you can see, the one that's called Portraits on the right is actually a true portrait of this individual. The image in the center is a right composite, which is a mirror image of his right face if he was completely symmetrical, and likewise the left. And as you can see, he looks like three different people, and I don't necessarily think that we can continue to adopt symmetry as a reasonable definition of beauty. So what else are we looking for in a face? And that's really kind of a step back with defining beauty and specifically with the face. We're looking for symmetry, but what else are we looking for in a face? I think you had mentioned looking into the eyes, looking into something deeper than what is quote unquote skin deep, something that's resonating through the eyes and into the face. And in Chinese medicine, we say that the face, like the tongue and the pulse, are actually a projection of all of the 12 meridians. It's all of the yin and yang and qi of the entire body. Facial recognition. I really liked this slide. We are looking into faces for familiarity as well. Being able to identify a loved one, being able to recognize someone. And I think this is really important, especially in our culture, when we think about how altering our faces might affect our relationships and the ability to be recognized. So, mentioning facial recognition, anything else we might be looking for in a face? Can you all think of something that I might be not mentioning? Expression. Have you guys seen my slides? You guys are good at this. Emotion, expression, I think those are somehow very well tied together. I liked using the baby faces. I have to tell you, there's a lot of babies in my slides. You can almost know exactly how each one of these kids is feeling. And even though we've frozen their images in a photograph, and it's not video, it seems very active to me. It seems like we have a snapshot of what's happening in the lives of these kids, and you can see the expression of emotion in the eyes, in the mouth, in the eyebrows. You see so much going on in these kids' faces. And so, what happens when we lose the ability to show emotion with our faces? Can you tell what these people are feeling? How does this affect their relationships? How does it affect your ability to be able to relate to them and know how they're feeling? I'll tell you. Excuse me.
Just go back to that other one for a moment.
All right.
Remember
Just so you
what you wanted to tell them?
Apparently not.
About our colleague in L.A., in Hollywood?
Oh yeah.
Would you like to?
Yeah, I think it's probably time. I don't know if many of you know this, but Botox, which is a botulinum toxin that some people have injected into their faces, which is a paralytic, and so it will paralyze or freeze the face. Usually the corrugator muscle, which is in the forehead here, is the most commonly injected with botulinum toxin. And even though the effects may only last 3 months, 6 months, depending on who you talk to, the research or the practitioner that you work with, Corinne and I have some colleagues in LA who are telling us that their businesses are booming in the facial acupuncture industry because there's so many young actors that are going to receive Botox so they can look younger and get parts. And what they're finding out is that they're not able to get the parts because they can't show any emotion. And so we have colleagues that are making their living reversing Botox with facial acupuncture. Thank you for reminding me to tell them that. You know, the media wants you to be really excited about injections, really excited about Botox. And I should tell you, I have clients that have received Botox. I'm certainly not here to make a statement about Botox. But I will tell you, of all of the images that I found on the internet about Botox, they all showed really happy faces. These women are showing us some emotion. And I just thought that was so interesting because, you know, I don't see any emotion in these women's faces. I put this one in there for you, Dusty. That's right. This is a still shot from one of our favorite films called Brazil. And, you know, it's a little bit of a joke, but what I have to tell you is beauty doesn't have to be like this. And it's not too much of a stretch to say that there are alternatives. So, when I was preparing for this lecture, I found a book called The Face of Emotion: How Botox Affects Our Moods and Relationships by Dr. Eric Finzi. This, I believe, was just published in January of 2013. And I really actually enjoyed reading this book. I couldn't put it down, so I have to tell you, I highly recommend it. Dr. Finzi is a plastic surgeon and found out in his own private practice that he could use Botox to treat depression. And so I'm confident that there are numerous people who have had a benefit from botulinum toxin. The idea being that if you are able to soften, this is his argument, this is Dr. Finzi's argument, that if you can soften or reverse this furrowed brow, perhaps you can alleviate the depression. Dr. Finzi makes reference to Charles Darwin's book, The Expression of the Emotion in Man and Animals. And this is directly from chapter 2 of The Face of Emotion. Darwin states, "The free expression by outward signs of an emotion intensifies it. On the other hand, the repression, as far as this is possible, of all outward signs softens our emotions. He who gives way to violent gestures will increase his rage. He who does not control the signs of fear will experience fear in a greater degree." In other words, like James Williams, Darwin had reasoned that the physical and outward expression of an emotion is important for the bearer to feel the emotion. He concluded that even the simulation of an emotion tends to arouse it in our minds. Now, that's the only time I'm going to read to you, but I think it's important because I would very respectfully argue with Dr. Finzi that when you inject botulinum toxin into the corrugator muscle to treat depression, it very much goes along with everything else that we do in conventional medicine. We treat the symptoms, typically. And we're not looking at what's happening underneath. Why was that person depressed to begin with? Are we treating the root? And that's the whole essence of traditional Chinese medicine. I want to find out what caused that furrowed brow to begin with. And I think this is a really good place to talk about the shen, the spirit energy, because arguably, when you freeze the corrugator, the third eye, when you freeze this area with botulinum toxin, my argument is perhaps you might be paralyzing that person's intuition, paralyzing their own spiritual energy, paralyzing their ability to feel anything. I think this is a good time for Dr. Wolf to share the definition of shen.
I teach at an acupuncture college in Sarasota, Florida, and it's difficult enough with young students to introduce them to the mystery of our medicine. And shen is one of those concepts that's kind of hard to put your finger on. So my favorite working definition of shen actually comes from the ancients. And it says that shen is the conscious aspect of spirit that shines through the eyes and shows itself glowing on the complexion. Shines through the eyes and shows itself glowing on the complexion. So when I think of clear shen, there is no better depiction than the face of a baby. A baby who hasn't been tainted by toxins, either of the mind or the spirit. And you've got the purity and the clarity just shining through. So your suggestion that beauty was from the eyes was perfect.
Thank you for that. And you know, really what I've learned with my work is that it's an incredible privilege actually to be able to work with clients who want to engage and go through this experience of facial constitutional acupuncture, because it's such a journey of revealing your original, true, beautiful face. We all have a connection to this shen. We're all born with it, according to traditional Chinese medicine. So this brings us to, I believe another comment was on what's happening on the inside. I think we had a comment earlier about, you know, the definition of beauty is really something that's happening on the inside. And that's what we're working with. Otherwise, why would we be doing constitutional acupuncture, which includes treating the body? That's one of the things that I think is so important, is really viewing this as an internal work. And this is why it's also important to not view this as a procedure. I have this posted right on my website, that facial acupuncture is not a procedure. We don't do a faceectomy, chop off your head, and just treat your face. Whatever's going on with you is going on with you. Whatever you're eating, how you slept the night before, these are all really important. Having a spiritual practice, Tai Chi, Qigong, yoga, meditation. Healthful aging. I'm really trying hard to spread this new term, so I'll ask you all to help me. I can't tell you how much I detest the phrase anti-aging. Anti-aging medicine, anti-aging this is an anti-aging product. It's anti, and it reminds me again of the language that we use in conventional medicine, which is antibacterial, antihypertensive, anti-anxiety, and I just feel like it's a fight. It's always against. And what I like to think about is, let's go with the flow, let's stop fighting, let's promote something. So I like the term healthful aging. So facial constitutional acupuncture, I started to at least try to define it for you. What makes the gold standard facial acupuncture that Dr. Wolf and I are doing with our teacher, Mary Elizabeth Wakefield, pictured here on the far right? What makes this different from other facial acupuncture that you'll find in the Bay Area? Because I can tell you that they're very different. Mary Elizabeth Wakefield pioneered this phrase, facial constitutional acupuncture. Her language is facial constitutional acupuncture renewal. And Dr. Wolf and I had worked with Mary Elizabeth Wakefield before we decided to do this undertaking, the 200 hours with the gold standard. But part of the reason that she's so appealing to me as a teacher is because she focuses on the entire body and mind. It is essential for us to treat spiritual energy, physical energy, emotional energy, as well as what's being projected with the face. And so the word constitution in facial constitutional acupuncture tells you that we are treating the body as well. So these are some of the benefits of facial constitutional acupuncture. And because of the color combination I chose for my slides, I'll read this out loud to you. I realize it might have been a poor color choice for clarity. Decreases stress and calms the mind. Diminishes fine lines and wrinkles. Tones and tightens the face. Clarifies the complexion. Sparks the shen is the language that we use for awakening that shen, that spirit energy. And balancing the qi of the body. And qi is a word we use in Chinese medicine to talk about energy. In other cultures, I believe we could call it prana. There's lots of different language for qi. But these are some of the few notable benefits. I had the wonderful privilege of getting permission to use this slide in my Elixirs of Immortality with you today. This is property of the Chakra Center and Mary Elizabeth Wakefield and Michelangelo. This is from the 2007 featured article on facial constitutional acupuncture in the New York Times section. And one of the reasons I really like it is it mentions the bagua, which we talk a lot about in Chinese medicine, yin-yang, but I love the color in this image, the superimposed color of the bagua over the face, and the fact that it's a rainbow. And I think what this image elicits for me is a reminder of how this process of facial constitutional acupuncture is really customized for each individual. That the way that one person experiences it, or one person's prescription, would be different than another's. So we study traditional Chinese medicine and use the practice of yin-yang theory, meridian theory, five-element theory, when we are going to choose body points for the constitutional treatment. I was here a few weeks ago giving a lecture on the fundamentals of traditional Chinese medicine, the three levels, the three treasures, the four levels, and the five elements. And we talked about some of these foundations. I apologize that I don't know the extent of everybody's education with traditional Chinese medicine. This is a nice image showing yin-yang aspect in each of the five elements, fire, earth, metal, water, and wood. And these are concepts that we use to choose the correct acupuncture points in a prescription for each client. So this is a really good place for us to stop. We're actually doing very well on time. So I'd love to take an opportunity to get some questions from the audience before we move into our next portion of this, which is a demo. I'm so excited that we get to do we're actually demoing facial constitutional acupuncture for you here today. So I'm really excited to share that with you. So let's do some questions. Yes?
How much of this facial acupuncture is like acupuncture herbs and how much is external acupuncture?
So the question is, how much of this is external versus internal? Is that right?
Yeah.
With herbs, with botanicals?
And also rituals and herbs, how much of that is part of facial acupuncture?
How much are herbs and needles a part of facial acupuncture? As well, so using botanicals internally as well as externally, is that what you're saying?
I just wanted to mix, what's the mixture of all the things you do?
Oh, so that's going to be revealed in the demo. We're going to reveal everything that we're using topically, and you know, I have to say, even though there is an internal component, that's very customized. So what I'll be doing internally with one client will be different than with another client, whether it's nutrition, supplementation, or botanicals. But yes, I mean, I use, and you know, I guess now's as good a time as any. These are custom, well, these are one of the ways that we can get to a custom blend. These were put together by Mary Elizabeth Wakefield, and they're different herbal masks that we can use topically, whereas if you wanted a more individualized approach, you could use any of those granules into your blend. So if you're an herbalist, there's so many ways to bring the topical approach into the medicine. Last time we passed around some tea, but it's actually back here in the beautiful coffee or tea urns for you. But we've made chrysanthemum tea or juhua tea for you today, and those of you who saw me at the last lecture know that this is an herb that I use in my practice topically and internally. I love to make flower eye masks with this. I was told that that's the image that the Asian Art Museum chose to promote this event. So if you noticed on my model on the posters, she's wearing a flower eye mask of Juhua. So thank you for that question. Any other questions about beauty, about facial acupuncture, about the gold standard, about what we're going to show you? Yes? Okay, that's a great question. I'm confident I won't be able to say everything that you just said, but let me try to summarize it for the benefit of the group. The request was for more information or clarification about what ancient traditions with applications for beauty, like what we talked about at the beginning, the jade rollers, the pearl powder from the blog earlier, that those items, what is essentially modern and what is old in what we're doing, is that right?
Yes, and also with the acupuncture, it's like the tea, so how did the ancients see these? Is the acupuncture practice now pretty much the same way it was then?
Oh, I see. How has acupuncture evolved in the past to where it is now?
Acupuncture, our use of herbs, our use of teas, our everything that we do now, how does that relate back into the past? And where we came from is usually connected to where we are now, and sometimes it helps to see that now.
Right. You know, and as much as I appreciate this question, I'll try to answer that to a satisfying level with you. That's a bit of what I covered in the first lecture was the fundamentals of traditional Chinese medicine. So, you know, really, but to tie it into the historical, because obviously, you know, Chinese medicine has been around for 5,000 years. So, of course, there are some things that have changed a lot. There are some things that, you know, just like passing on a recipe, it changes. But there are also ancient texts like the Materia Medica. There is, you know, the Shen Bang Cao. There's ancient texts that we study. It's a 4-year degree to be practicing with a master's degree in traditional Chinese medicine in the state of California. And it's imperative to be familiar with the classical formulas. So the truth is we're still using formulas that were used 5,000 years ago in botanical medicine. But of course it's changed because now we have the internet. Now we have Ayurvedic medicine, we have Tibetan medicine, we have American herbs. There are herbs that I use in my practice that maybe Dr. Sun Miao didn't know because the herbs didn't grow there. So the modern day herbalist will oftentimes utilize their fundamental background of the original works, but it's great to be able to bring in new knowledge. As far as acupuncture, even the use of acupuncture, the first acupuncturists were treating shen disturbances. Actually, we call it shen disturbance in Chinese medicine. When people had mental health issues, emotional imbalances, the first acupuncturists were the early shamans to help balance and settle the spirit. The ancients believed that you have a sore throat, or you have a headache, or you can't sleep because your dead ancestors are really angry with you in the way you're living your life. I don't practice that way now. I like to use my modern knowledge of medicine as well as my education in traditional Chinese medicine. So I like to blend it myself. Do you have any other ways to answer this question for her? Yeah, please. It's a great question.
It is a really great question. And as a very, very Western practitioner of a tradition and a history that's so steeped in Eastern. I mean, not only am I Western, but I'm from New York, okay? So I want to know, what do I do? How do I do it? Da, da, da. Even our most ancient textbook in the tradition of this medicine, 2,500 years old, the Wang Dina Jing, isn't really a textbook. It's actually an accounting of a conversation that took place between an emperor and his doctor. So much of what we say are beauty secrets from the past are anecdotal, are knowing that from different places we've gleaned how important longevity, even just why we're all here today, how much anti-aging and longevity was part of the tradition, part of the fabric of the culture. So things like the herbs that we use today, the juhua that Amy mentioned, same herbs that were used way back when. The jade rollers, we have evidence that the jade rollers have been used for thousands of years. There's the anecdotal, this one's a fun. Yang Huan, the most famous concubine in Chinese history, was also renowned for her delicate skin. She used lychee, an herb, rich in protein, vitamins B and C, phosphorus and iron, which all bubbled away in her regular hot spring bath. The bath not only moistened her smooth skin, but also refreshed her mind. So much of what we can say to you is steeped in the tradition, are these wonderful, rich references to what's been done in the past. Does that help a little?
And I'm glad that you brought that up, Dr. Wolf. Thank you, because you mentioned the lychee, and it's funny. I've been actually doing some research on lychee and mangosteen because they're the origin of S. boulardii, which is a beneficial yeast that helps to keep our skin free of candidal infections, which is like what we would normally call a yeast infection, right? Sometimes people have abnormal yeast growth. And so it's interesting that even so long ago, they were using lychee. They didn't necessarily know that they were able to identify, maybe an S. boulardii, but they knew that there was a benefit, and maybe perhaps it treated yeast.
What are the qualities of jade that make it effective as a jade roller? Why would they not use another stone?
Okay, so the question is, what are the qualities of jade that make it so effective as a jade roller, and why would they not use another stone? That's an excellent question. Oh, you're just going to return these. Okay. So I pass these around. So jade is considered, the properties of jade are considered to be very cooling. And one of the reasons that we use jade rollers in our practice in the Facial Constitutional series is because they're actually used at the end of the treatment. And the reason they're used at the end is because we've just brought all of this chi and energy and blood up to the face. We've needled the face. So everything is kind of, it's like a flower that's sprouted. It's very open. And after we put in the nutrients, like the moisturizer or any other serums, we want to close. So it's very, the practice of Chinese medicine also happens to be very artful as well as effective. So when you practice Tai Chi, you open, you close. You open, you close. Almost everything that we do in this medicine is balanced with yin and yang. So to open, now we want to close. And that's what jade does. It cools and closes. And it feels really cool and beautiful on the skin. I don't know if any of you rolled this on your skin when they were passed around, but it's very cooling. So you will close the pores and lock in the moisture or the treatment.
Well, you have that in your hand. Can you demonstrate the direction?
We're going to use it in the demo. So absolutely. The question was, will you demonstrate the jade rollers the direction of the jade rollers while you have them in your hand? And I'm going to let Dr. Wolf do that on my model. So I think this is probably a good time for us to move into the demo. What do you think? Are you ladies ready? Okay. So I will admit to you, this is the first presentation of the Elixirs of Immortality. So we have not been through this before in front of an audience. Janice has agreed to be our model, so thank you for being here. And I will tell you, the audience, that you will have an opportunity to ask questions of Janice or of Dr. Wolf of the demo. And so what I'm going to be doing while they're doing the demo is trying to narrate and give you information as we move forward. I realize that it's probably not something that you're all going to be able to see very well. We don't have a live video feed for you, but some of these slides are going to be helpful for you to see what's going on. So we start always with observation and diagnosis in Chinese medicine, and this involves looking at the patient's face, taking the pulse, listening to the patient's voice. Sometimes it has to do with the smell of their breath. We're collecting as much data as we can to give the client the best treatment. These are just some of my delicious artwork. Jamaica, I know it's not as good as yours. No, what I like to do when I sit with the clients and engage in conversation, the consultation about facial acupuncture, I want to make sure that I understand what they want. What changes do they want to see in their own face? And so this is something that's very important to me. I make a drawing, and I use the letters A, B, C, and D to identify with language, what we're talking about. So, for example, the drawing over here on this side, I have A is listed as the corrugator lines, what I sometimes call the 11s. This was the client's primary concern. B was what we commonly call the crow's feet or the smile lines. C was the superciliary arch. He wanted really to see a lift in his eyes. And D, I put at the bottom here, is just an overall change in the luster and complexion of his skin. So these were his goals. And if, you know, this is absolutely going to be a demo and not a true treatment. We don't have time to do a true treatment, which is 90 minutes. So, but yes, please.
Explain the pillow, the small pillow.
The small pillows. Of course, I'd love to explain these small pillows. These are some of my favorite part of my treatment. The question was, can you explain the small pillows? This is not something I learned in school. This is fairly organic. We used to use these little pillows to place the hands and palms across so that we would have a better angle to feel the radial pulse. And what I found in my private practice is that I like to take the patient's pulse when they're laying down. And the pillows became a great gift, I guess I would say, for each client, something to do with their hands. And I always tell my clients, your job is to keep these pillows from rising to the ceiling. And they get a kick out of that. It's something peaceful and pleasing, and it's also talking about the 5 senses, it's a tactile way to kind of clue your body in that it's time to relax. I think there could be some kamet or buckwheat in there. Oh, flaxseed, thank you. Yeah, they're quite beautiful. Actually, I had so many clients who commented on how much they enjoyed these little hand pillows during their sessions that I had them as a holiday promotion one year at my clinic for my clients. So, but they're very peaceful and they're also very beautiful. Thank you for asking. So, just making sure that I know what my patient's goals are is really important to me. You don't want to get through a series of sessions with facial constitutional acupuncture to find out that, oh gosh, I thought they wanted me to work on that scar. It turns out they really like that scar. It reminds them of something. So it's very important to just make sure that there's a lot of clarity with communication. So at my clinic, At this point, there would be a cleanse and some steaming. And we have hot towels that are often used during this part of the experience. There's music. We're starting to awaken the shen to relax. I also like to use essential oils in my practice, and sometimes I'll actually use the essential oils in the steam so that they are more like a hydrosol, that you're breathing those in, because essential oils have such a powerful way to awaken the spirit and calm the mind. A lot of the topicals that I use do have these essential oils. Other modalities used, as Dr. Wolf is demonstrating over here, are the tuning forks. And both Dr. Wolf and I study sound therapy with Mary Elizabeth Wakefield as part of our gold standard facial acupuncture. Sound therapy is very important. You not only experience the sound, which is why, you know, Dr. Wolf, you'll see her do the tuning forks by the ears, but then we also use the vibration that's created with the forks through different acupuncture points in the body to elicit different responses. Oftentimes we'll be brushing botanicals onto the face. I like to use usually a botanical mask with a pearl powder, or sometimes longgu or mu li, which are other Chinese herbs that we use, because they have this kind of heaviness or sedating quality. I like to use those especially with the eyes to really help someone who's especially had a long day to really de-stress and relax. Using these different tuning fork instruments, even around the orbits of the eyes, around the jaw, the forehead, these are excellent as far as stimulating the muscle structures around the face. Corinne is placing jade stones over Janice's eyes right now. Oftentimes we will use jade not only in the form of rollers, but as small weights on the eyes. They're very soothing. So whether or not we're going to use juhua, or we're going to use, which is the chrysanthemum flowers that I showed you earlier, or other topicals, it's very organic. So it depends what's going on with that client on that particular day. And the clients who've worked with me extensively know that it's a little bit like a dance. So it could be that my client will mention, you know, this is really what I need today. I've just got some bad news. Can you spend a little bit more time grounding me? Oftentimes there is a really important, it's very important to do grounding work with these folks, which I had in a slide back, that we use these longer tuning forks on the feet. These points called kidney 1, these are very grounding. And this is also what you can do if you have too much chi or energy coming up to the head. I have a couple clients that midway through the acupuncture will say, I'm starting to feel like I need to be grounded. I'm starting to feel like I need to drop back down into my body. Because you really do bring a lot of chi and blood up to the face. So this feels really wonderful. I also started using tuning forks as tuning fork facials in my practice because, you know, not everybody likes acupuncture. Not everybody likes needles. And so I didn't want it to be a prohibitive in working with me. Since I've integrated the tuning forks into my practice, I've actually found them to be quite powerful. And I think some of the reason that I've gotten the results that I have is because I'm using the forks. We've been responding, oh, go ahead. Sure, I'll be happy to explain. Her question is, would you mind talking about the points that she's choosing in her demonstration? So right now she's doing some points on the chest, and the sternum is a very important part of, I would say, receiving vibration, because it's a long bone, and it really resonates quite easily through the sternum. We have several acupuncture points along the sternum. There's also, on either side of the sternum, what we call the kidney spirit points, or sometimes the kidney shoe points, and these have to do with addressing an emotional issue that might be going on with that particular client. Also, sometimes it's about just giving the patient a little bit more energy or opening the chest. So a lot of people hold so much stress that they don't even realize, and it's only when we're starting to activate the parasympathetic nervous system, we're starting to ask the body to relax, even give the body permission to relax, that people say, I can start, oh, I can breathe now. That feels so good.
Is that also good for the immune system near the thymus?
The question is it good for the immune system? Because I see that those points are near the thymus. It's interesting that you mentioned that, because the planetary forks, this particular set is called the planetary forks that Dr. Wolf is demonstrating, very much correlate to different energies in the body, and I think in some languages they're called chakras. But whether you're talking about traditional Chinese medicine and active points on the Ren channel, which is the front of the body, or if you're talking about balancing an endocrine system, these really correlate rather beautifully. So you're speaking to that person's parasympathetic nervous system, and you're speaking to the hormones, of course. You're going to, through a constitutional treatment like this, you're treating the whole body. So I would say, yes, this does benefit the immune system. There are certain other points that you could use with your forks to benefit the immune system. There are certain other forks you could use. It's just like being an artist, having different tools, having different colors, different paint brushes. And so what Dr. Wolf is demonstrating now while I'm answering your question is contralateral balancing with something that we call the 8 extraordinary vessels, which is a much deeper level of vibration that goes to what we call the Jing level, and that's how we start to really get this to sink deeply into the level of the shen.
I would add to that that the tuning forks are probably not something that were used 3,000 or 4,000 years ago, but the concept of using vibration and the concept of using sound is absolutely rooted in the ancient tradition of our medicine. This just makes it a little easier.
Yeah, it's a little bit different than holding a didgeridoo. Sound healing has been used for a long time, and actually I have a friend who was healed with a didgeridoo, so it's just fun to say didgeridoo. But no, sound therapy has been used for so long, and we're lucky. I mean, this particular form of sound therapy is these forks are made by a company called Acutonics, and I believe Acutonics has only been around for about 20 years, so that's very young medicine. But Dr. Wolf and I just finished an intensive in Santa Fe, New Mexico in November, where we studied sound therapy for 2 weeks, and had to study some music theory with it as well, actually. It's important when using tuning forks to understand what's happening with a unison, a harmonic, or a dissonant tone, and how those affect pain, how those affect the spirit energy, and how those affect the meridian systems. Yes?
I think it would be helpful if you held the mic to Dr. Wolf's mouth, and he could be talking, describing what he's...
As much as I appreciate, so the comment was to change our setup for the mics so she could be talking about what she's doing. As much as I appreciate that, I'm seeing that we're running lower on time, and I want to make sure that, but if I do appreciate your questions, and so please ask me so that because the way we had planned this was that I would narrate. It's pretty tough to actually be the narrator and the demoer while you're working with the client. It kind of disturbs your focus.
Well, if you could actually
Talk about it? Sure. That sounds good. So right now she's demoing what are called the low ohm forks. This is the grounding that I was mentioning earlier. after all of this work that is done typically with the botanicals on the face, it's just very important to bring the energy, like I said, with the opening and the closing. It's a little bit of a rhythmic dance that we're doing with this. And also I think it's important to know that even though we are trying to elicit a demo for you, this is not an actual treatment. It's very important to do an actual treatment in a much more intimate space. Yes?
Into beauty, basically. This is what you're talking about now, but what about, do they fill in a form that tells about illnesses they have?
That's a great question. Thank you for bringing that up. So the question is, this focus is really on beauty, but are they filling out any kind of a form that tells you about their past medical history or any illnesses that they have? That's a great question. And of course, the answer is easy because it's yes. You know, there are many things like migraines, hypertension, and pregnancy and herpetic outbreaks that are contraindications. This is not something for everyone. I'm only going to go back to the demo for a minute before I continue answering that question, as Dr. Wolf has started her needling.
So the first set of points that I'm placing are with the intention of calming the spirit and calming the mind to prepare the body for the treatment.
Thank you for that. So it's very important to understand what's happening on a constitutional level with the body. I have a 7-page biohealth assessment tool that I have my clients fill out before I work with them. And the consent form is actually, I think, about 5 pages long. Yeah, this is very serious. This is a very serious undertaking. And it's very important to understand someone. This is absolutely, as I mentioned before, not a faceectomy. We're not only working with the face. And so understanding if someone has a bleeding disorder, or understanding if they have, if they have psoriasis, maybe she just had a baby a month ago. Maybe she's postpartum. One of the clients I had that had one of the best results was actually postpartum. So she was 6 weeks postpartum, and she said, I'm excited about doing this work with you. And here's the thing, ever since I had my baby, every time I cough, I lose my urine. But can you help my bladder? Ever since I had this baby, and I thought, what kind of a practitioner would I be if I'm not helping her with her stress incontinence, with her bladder chi, while I'm helping her look gorgeous? It's not just about looking good, it's about feeling good. It's about being healthy from the inside. And so I worked with her bladder every time I worked with her face. It's important to incorporate them. And so that's why so we're moving on with the needling over here, and it looks like we're doing some needling directly into the corrugator muscle, which is, as I mentioned before, the most commonly Botoxed area in the United States. And I will remind you, you'll have an opportunity to ask Janice at the end what this feels like. But it's the needles that are being used in her face are what are called a 40 gauge needle. We have different gauges of needles in acupuncture, so the 40 gauge is actually quite thin. It's about the size of a human hair. And so now Dr. Wolf is adding some body points, the contralateral, I call them the 8 extraordinary vessels. So it's very important as we're moving in and out that we move up and down, right and left. So it's very balanced. It's very important to have a very balanced needle prescription for every client. I would never needle a patient only just on the right side of their body, only on the left side of their body, only yin points, only yang points. It's a bit of a dance with yin points, yang points, right points, left points. And really what you're creating, and I'll kind of walk around to show you this, there's a circuit of energy that's actually moving now in a symbol of the infinity. So it moves through one leg and out into the next leg, across the body, in through this arm, up through the shen, out through that arm, and crossing over again. So this is one theory of meridian flow with acupuncture needle placement. I only see one client at a time. When I'm doing the needling, it's very important for me, as I mentioned before, this inya and this focus. You really need to practice energy work to do this. You need to make sure that you've had breakfast, that you've had a good night's sleep, that you're taking care of your own self, that you're doing your own meditation, your own Qigong practice. Because if you're going to be working with someone's energy on this level, I think the prudent practitioner takes care of him or herself. So yes, there's another question.
The wrist point that she just put
Yes.
what does that correspond to?
So the question is the wrist point that she just put the needle in, what does that correspond to? So that's what I was just mentioning with the contralateral needling and the 8 extraordinaries. That's what we're creating.
No particular organ?
So the question is it about a particular organ? The answer is no. This is a facial constitutional acupuncture, and although you may know that lots of different, it's just like a symphony. What is a C sharp indicative of? It's being used in a certain way in this piece. And so I think, go ahead.
It's a specific point though, right?
Yes.
That's in.
The name of this point that's being utilized over here is Lie Chue. It means broken sequence. So the study of acupuncture points actually is quite beautiful. So you can learn a lot about what's happening with the utilizations of points by learning the Mandarin names. Yes?
Needling, will that help relax these muscles in terms of a type of reduction of lines?
So the question is, will the needling of the corrugator help relax the muscle and relax the lines? The simple answer is yes. What we're doing, actually, is creating what I would call a microtrauma, right? We are creating a microtrauma in this subcutaneous region. And what does that tell the brain? It tells the brain to send healing nutrients here, send blood here. And you are creating fibroblast and collagen production with needling in this area. I think we're probably good if you are getting to a point with your needles. I'm keeping an eye on time. And so, as you can imagine with the needling on the face, there's lots, at this point, you may know, these muscles, especially the masseter where she is right now, these are really powerful muscles. So the rich blood that's coming up here, there's a lot of energy and chi that Janice is probably feeling right now in her face. Yes?
How deep do the needles go?
The question is, how deep do the needles go? And that's a great question. It's depending on technique. To practice acupuncture in the state of California, you need to memorize the acupuncture point, its insertion depth, and angle to the millimeter for state board exam. So every point has a different answer as far as how deep that you go. It also, of course, depends a little bit on anatomy. Of course, people have different thickness or thinness of skin and subcutaneous and muscle structure underneath. A lot of this has to do with palpation, so you really want to make sure that you understand your client's face. I think that working with one particular client, I may needle differently than another particular client, and it also has to do with what you're trying to achieve. We sometimes use more of a threading technique. It's called threading when you're really following a muscle structure. So you might say that that's deep. Usually there's a transverse angle with that. Other points are really more energetic, so you want to call the chi to that area, but it's not so much about threading or really getting deeply into that region. Go ahead.
Just things to keep in mind. The needles do many things in the treatment, as do the tuning forks. These are our ways of accessing and activating the points. So some of the needles are placed with purely the intention, as Amy said, of stimulating the flow of chi and blood. Some of the needles have very specific intention of toning and tightening muscles, or perhaps even relaxing the muscle before you tone and tighten. We acknowledge there are tensions and microtensions, so sometimes it's a question of relaxing before you can tonify. Each of the needles has a different purpose. Every treatment will vary. Once a background has been determined as to what the patient is looking for as far as achieving results, then each individual treatment will change somewhat slightly based on how it's proceeding. You know, you start the first treatment and then 2 or 3 treatments later you may be adjusting and modifying and working on things as you go along.
When does the acupuncturist decide whether to use the electrical thing or the needle?
So the question was, when does the acupuncturist decide when to use the electrical equipment or the heat lamp? You know, I believe that using any modality it's just like asking, you know, I mean, I hate to say it depends, but it really depends. I mean, it's like asking an artist, when do you grab that paintbrush? When do you use red? It's that, you know, and you work it out with the client. I mean, I may want to use a particular technique like microcurrent, which I do use with my clients, but not everybody wants to receive microcurrent. So it also depends on, you know, what's going on for that client on that day. The TDP heat lamps or the infrared lamps, I use those in almost every treatment because when you're properly stimulating the parasympathetic nervous system, you get a little cold. And that's why we'll probably wrap up Janice's pseudo treatment pretty soon, because this is a much larger and colder room than she's used to. And so I don't have a heat lamp in here for her. And I actually told her that would be the hardest part of getting through the demo, would be how cold she would be, because it is very much about going in, going yin, and going deep. And it's hard to do that in a room this large. So thank you for all these questions. I actually really prefer this kind of a discourse. So thank you. I really appreciate it. It's wonderful. Yeah, I think that's a good idea. So we're going to start to remove some of these needles. Typically, I use these tiny little spoons. I put here, Corinne. I put these tiny little spoons typically on ice and remove the needles from the face with iced spoons, because it immediately closes the vasculature and prevents bruising and bleeding. So I have to say, it's been really fun to do a live demo in front of a group. Thank you. This is just another slide while she's removing needles. Another botanical eye treatment and mask, and so this was not included in your demo today, but of course there are some times that I'm choosing to use this kind of a treatment. Another image of facial needling. I had put this up there for you just so you could appreciate what a close-up view looks like with these small implements. Yes?
Typically, she would have left the needles in a great deal longer, yes?
Yes, good question. Typically, she would have left the needles in a great deal longer. That's correct. An actual acupuncture, constitutional acupuncture consultation and treatment in my clinic, in my practice, is 90 minutes.
How much time are the needles left in?
How much time are the needles left in? So it depends. I have some clients that go about 11 or 12 minutes. I have other clients that go as long as 28 minutes. Usually that's the range with my clients is 11 or 12 to about 28 minutes. It really depends on what our goals are, how much time we have, what else I'm incorporating. If I'm doing microcurrent, if I'm doing other topicals, embryonic proteins, anything else that's going to, you know, part of this is a strategy of creating the experience for the client, but also taking time to do what I call the closing ritual. If you're going to bring all this chi and blood to the face and do needling, it's important to close. And so oftentimes the closing ritual will involve Dr. Wolf has left the body needles in while she's removed the facial needles, which is part of our practice to keep the chi of the body still grounded and circulating while we do the closing session for the face. Closing, typically, we might use tuning forks. I might use embryonic proteins, like I mentioned. I also use moisturizers, tonics, toners. Now is the time to really drive in any beneficial product into the skin, anything you want the skin to soak up. The Zen Therapy treatment gel that I left on your chairs, this is when I would be applying the Zen Therapy treatment gel. And then, of course, I will finish the treatment with the jade rollers, which we will demo for you. We have time for that still. I've enjoyed these questions. Yes, go ahead.
Yeah, I'm a little confused. What is going to happen to her? What was before and what will be after?
The question is, what will happen to her? What happens in the before and the after? I swear you've seen my slides before. Okay, I will show you immediately after. Hopefully, you wake up feeling refreshed and beautiful. I talk about, and we can talk about this too. What can you expect after your first treatment? What can you expect as you move through with this? It's very important to eat good food, as you can imagine. Get a good night's sleep. Stay well hydrated while you're doing this process so that you can have good results. I also recommend supplementation when necessary, like gamma-linolenic acid. Borage oil is very good for skin health. But as much as I could bore you talking about essential fatty acids and GLA, it's probably just a good idea to show you the results that I'm getting. So this is what you might expect.
She looked pretty good to start with.
Well, this one did look pretty good to start with, didn't she? That was a little bit good luck on my part. No, actually, what I'm trying to show you with my before and after photos today is what you can experience or expect through a whole series of treatments. This is not typically an isolated experience. So I see clients typically for 10 or 12 weeks in a row to get these kinds of results. And I'll get to your question in just 1 minute, ma'am. I'm going to tell you some of the things that I see in these photos, and then I'd really like to hear about what you see in these photos. But one of the things that I see in the before and after, and I will tell you, these are unretouched photos. My model did apply lip gloss before she went in to see my photographer, which I didn't catch. So she is wearing lip gloss on her lips, but she's not wearing any makeup on her face. So I will tell you that what I see as the benefit in this particular client, so in like her whole complexion, even her expression in the before photo, she looks almost vacant and dull, like she's a visitor in her own body. Like she maybe is not feeling very satisfied, she doesn't look particularly even happy. I see that her eyes there's a little bit of discoloration under the eyes, maybe even a little bit of uneven skin texture through here and color. And I see, some indication of some possible work for me to do with the neck. In the after photo, I see that a lot of this has really changed. All of those things have changed. But the most remarkable thing that I see in the after photo is the shen. And you don't have to study Chinese medicine to see shen. You can look directly into the eyes of this photo and see that she looks awake. She looks like she just meditated. She looks absolutely beautiful. And this is how I would define beauty, is looking at this face. And this is part of that can be experienced through facial constitutional acupuncture, is this revealing of your own true original face. And that's why this work is so exciting for me. I have some side profiles of this client and her results, and some of the attributes are more easily seen in the side photographs. You can see the neck and chin area here, how that has changed with her treatment. I see also the nasolabial area here, and the risorius muscle has changed. Definitely the coloring around her eye is lighter in this one. And overall, her complexion looks a lot better. Needless to say, I think that this client was happy with her results. Here's the other side profile. I had just given this client an ear massage, so I apologize that her one ear is so red. That's because I gave her an ear massage. You can see once again, the color of the skin, the luster, the quality seems so different to me in the after photo. And this is another one of my before and after photos. Another client who he actually was my drawing, and he wanted to work around these the corrugator lines, which I can tell you on my computer when I'm zooming in on it to really get in there with the pixels. I'm really impressed, but they're almost completely gone in the after photo. I have to struggle to see his 11s, I call it, or the furrows. He also wanted his eyes to look more lifted and more open, and I think we were able to achieve that. I think that the eyes really, especially this eye, looks the most improved. Every treatment we do obviously is bilateral. We would never just treat one side of the face, even with like a Bell's palsy or a stroke patient. We're always doing a bilateral or both sides treatment. Also, you can see in the neck and chin area, there's improvement. But overall, especially with this client, what I see is the luster of the skin. He almost looks more nourished, more moisturized in the after photo compared to the before. And also, again, the shen, looking into his eyes. He looks tired in the before photo, and in the after photo, I almost see him as a little boy, like his baby shen coming through. And like I said, I find this work to be really, really rewarding. We have about 7 minutes left, so I think it might be a good idea to see, do you have any questions for Dr. Wolf? Do you have questions for Janice? Do you have questions for me? Yes.
I just want to know what pressure you put on the jade roller.
How much pressure do you put on the jade rollers? That's a great question. I think it's variable. It's just like a massage. When you go in and get a massage and the therapist says, please let me know if this feels like too much pressure or not enough, typically the client will give you that kind of feedback. Thank you so much. Oh, excuse me, yes.
How many times would the session be, and how often would they repeat? Like once a year, once every 6 months for the sessions? Like you do 1 treatment or 5 treatments or 10 treatments, and then how long?
To repeat. Okay, so I think the question is, if you've done a series of 10 or 12 sessions, how often would we need to meet to maintain those results? Is that right? So it actually, of course, as you can imagine, it depends on how well that client is doing their lifestyle work. I can't tell you how important it was to educate my clients about that piece. If you are, you need to make sure that you're doing your nutrition, your supplementation, your hydration, your stress reduction. There's a part of it that I can't do. I need to be working with clients who are willing to do their part to get good results. And so a client that's doing all their homework, 100% compliant Dreamboat client, I may only need to see them either once seasonally for the first year after completing a series, maybe every other month. So it depends, this is the kind of thing that I like to do, with the client and with schedule and obviously with finances. But to come up with whatever the interval is, that it's consistent I think a consistent interval is important. And then it is recommended to finish an entire, to renew the entire series again in anywhere from 5 to 10 years. For some people, it's 3 to 5 years. It depends, as Mary Elizabeth says, if you're working with smokers and saggers. It's actually more important to take care of yourself and do the internal work than would be maybe like for age. Some people think that older people are going to have a harder time holding results, and it's actually not true. It doesn't have a lot to do with age. It has to do with how well you're doing your own self-care and taking care of yourself. So, does anybody have any questions for Dr. Wolf or for Janice about the experience? We have 4 minutes left.
I would just love to add to what you were saying.
Yeah.
I have seen patients as young as women in their 20s and 30s who want to get ahead of the game, to my personal eldest patient that I worked with through a series with and continue to see was 92 when she came in. And she came in on her walker, and she looked at me and she said, "Honey, let's see what we can do." And I will tell you, she enjoyed astounding results. Astounding results. It didn't make her face completely wrinkle-free. It would have taken a while. But it changed, and as Amy keeps pointing out, it's the shen that shined through got brighter and brighter and brighter. And she's a snowbird, so I still see her in Florida every winter.
Well, that was the Elixirs of Immortality, Ancient Medicines and Modern Beauty. I want to thank all of you who stuck it out to the bitter end. I know it's a beautiful day out there, and there's a jade exhibit here in the museum, the Warriors exhibit here, and I hated having to compete against the 20% off in the gift shop today for members, but it's true. If you'd like to contact me at any time, this is my email, and I run my business from my cell phone. I'd be happy to hear from you, happy to honor any of your other additional questions or any feedback you have about the presentation that we did here at the Asian Art Museum. I want to thank Allison and thank my sound team and thank everybody who helped make this possible today, Dr. Wolf, my model Janice, and my support team, and all of you. Thank you so much.